Hi there healthy souls, I'm Dr. Priya Kaushik. Welcome to my channel. Your go-to destination for all things health and wellness. Please consider subscribing to my channel. This is a very interesting story. Imagine a war inadvertently kickstarting the development of modern chemotherapy. A tale where the battlefield became the birthplace of a medical breakthrough, turning mustard gas, a weapon of destruction, into a weapon against cancer. During World War II, a German bombing of Bari, Italy led to chaos. Amidst the destruction, a ship containing 2000 nitrogen mustard gas bombs sprung a leak, poisoning the air with a deadly nitrogen mustard gas. But from the chaos came a curious find. The gas messed up the bodies in a weird way. During autopsy, what they found was astonishing. The nitrogen mustard gas destroyed the bone marrow and lymphatic tissue. Once a villainous gas held a potential as a hero against cancer. By testing it on mice, they observed that the cancer cells shrunk away in fear. Excited by this discovery, they dared to try it on a brave man fighting lymphosarcoma. And that's how a villainous gas turned into a superhero against cancer. Who knew a deadly gas could have such a surprising twist? Chemotherapy, aka chemo, is a common cancer treatment that uses drugs to kill the cancer cells or stop them from growing and multiplying. It is one of the several treatment options available for cancer patients, alongside targeted therapy, immune therapy, hormonal therapy. Each type of cancer treatment works in a different way. They can be used alone or in conjugation with surgery or radiation, or it all depends on the patient factors, type and stage of the cancer. The main difference between traditional or standard chemotherapy and other forms of cancer treatment is that in traditional chemotherapy, we use drugs that act systemically, that is, throughout the body, which leads to the destruction of both normal cells along with that of the cancer cells. This, in contrast to the targeted therapy, where the drugs target on specific proteins or receptors on the cancer cells, hence sparing our normal cells. Hormonal therapy is particularly used in certain type of cancers like breast cancer, uterine cancer, prostate cancer or endometrial cancers, where cancer cells use our natural sex hormones like estrogen, progesterone or testosterone to grow. Hormonal therapy works by making the cancer cells unable to use those hormones or preventing our body from producing them. Immune therapy, on the other hand, helps or boosts our immune system to recognize and fight the cancer. First, curative chemotherapy. It aims to cure the cancer by destroying the cancer cells completely. Second, neoadjuvant chemotherapy. Neo means before. So this treatment is given before the primary treatment such as surgery or radiation, which helps to shrink the tumor cells. Third, adjuvant chemotherapy. This is given after the primary treatment such as surgery or radiation to kill any remaining cancer cells and to minimize the recurrence. Fourth, palliative chemotherapy. This is not a curative one. It is used to decrease the symptoms and improve the quality of life in advanced cancer. Kate Middleton has recently undergone abdominal surgery followed by preventive chemotherapy. So what is preventive chemotherapy? Preventive chemotherapy is nothing but adjuvant chemotherapy, in which the treatment is given after the primary treatment such as surgery to kill any remaining cancer cells or reduce the risk of recurrence. Whereas cancer chemo prevention is the use of chemotherapy drugs in high-risk individuals who have a genetic history or a family history of cancer, but they have not yet developed the disease. Routes of chemotherapy administration. There are various methods through which we can administer the chemotherapy drugs. They are IV, that is intravenous, direct injection into a vein allowing the drug distribution throughout the body. Oral, in the form of pills, capsules or liquid. IM, that is intramuscular, this is less common in use. Subcutaneous, injection is given under the skin. Topical application, such as creams, gels, patches directly to the skin for localized treatment for certain skin cancers. Intraperitoneal, direct delivery of drug into the cavity like abdomen or bladder for certain cancers like ovarian cancer. Intrathecal, into the spinal canal for CNS, that is central nervous system cancers involving leukemia and lymphoma. Intra-arterial, injecting the drug into the artery supplying the tumor. After chemotherapy, your body might experience a wild ride it never signed up for. Not every single person experiences these. Some experience more, some experience less. Let's see what these are. Chemotherapy drugs are like overeager gardeners. They zoom in on those pesky cancer cells that are multiplying like rabbits. But there's a kicker. They are a bit blindfolded. They can't tell the difference between the bad guys and our own innocent, rapidly glowing cells. So they start snipping away our normal cells, causing all sorts of drama. Imagine our blood cells, skin, nails, hair follicles, and the cells in our mouth, tummy, and reproductive organs getting caught in the crossfire. Cue the parade of side effects. Anemia, infections, bleeding, loss of hair, dry skin, dry nails, decrease in appetite, hence weight changes, decrease in libido, fertility issues, and so on. And just when we thought the show was over, surprise! Some side effects might linger, like uninvited guests on our couch crashing for months or even years. It's like these drugs have a vendetta against not just cancer, but also our heart, lungs, kidney, bladder. Talk about the wild ride. Remember, stick to those follow-up visits like your favorite TV show. Missing an episode could lead to some unexpected plot twist, especially the kind involving recurrence. As you watch the video, you can observe that in the midst of World War II, amidst chaos and destruction, chemotherapy was born on the battlefield. It's a reminder that even in the darkest times, there is a potential for incredible breakthrough. So let's approach life challenges with a positive outlook, knowing that every difficulty carries within it the seed of opportunity. Stay healthy, stay happy, and keep smiling through it all.